Hello, hello, hello. Good evening, everyone. We are about to start the Health Caring Differently Instagram Live. Oh my gosh, I'm like excited and sad at the same time because this is the last episode for this season. It's not the last episode, but we're doing the last episode for this season. But I'm so excited to have Naheed join me as my guest. I'm just gonna bring Dr. Dosani. It took a while to be able to get this to happen, but I'm delighted that Naheed is joining. Let's see, there we go.
Hey,
Hello.
Anya. Hi.
Hey, hey. Welcome, welcome, Dr. Dosani. Welcome. Um, so Nahid, what I'm gonna do is I'm gonna like launch into oh, you're getting hearts already. Okay, okay, the love. All right.
Much love.
Big Tigs, right away. All right. What I'm gonna do is I'm gonna do like the general intro and I'll do your bio. I remix everybody's bios, by the way.
Sounds good.
Slight remix. Not like you can't recognize the song. Slight remix.
Fair enough.
And then we'll launch into it,
That
right?
sounds great.
So,
Awesome.
okay.
Thanks for having me, by the way. I really appreciate
Yeah, no, no,
it.
no. I mean, we were trying to like coordinate it for a while, so I'm so glad that it happened, especially because, like I was just saying, you are the last episode for this season, right? We start the fall season in September, so I'm really glad that we were able to do this. So, for all of you who don't know, my name is Dr. O, and I'm the host of Health Caring Differently, where I interview physicians and healthcare leaders who are different and approach their work differently because of their identities. So we don't just roll with status quo, but we bring in a different type of energy. And I'm hoping that you folks, even though I said today is our last episode for the season, I hope you continue to follow us on Instagram and on our socials, and continue to get the newsletter, because our monthly newsletter will be featuring more and more summer job opportunities for you folks to like be in hospitals or clinics or research. So please look out for the newsletter, and I'll be putting some videos, online during the summer, so you can see how I healthcare differently. But yeah, so you'll hear a little bit more from me over the summer as we prepare for the fall season. But today we have Dr. Naheed Dosani with us, and I'll do your bio. So, as a palliative care physician and health justice activist, Dr. Naheed Dosani is dedicated to advancing equitable access to healthcare for people experiencing homelessness and marginalization. He is the founder of the Palliative Education and Care for the Homeless, aka PEACH, program at the Inner City Health Associates. He serves as the medical director of Kensington Hospice in downtown Toronto, and as a health equity expert advisor in the Canadian Partnership Against Cancer. He is a palliative care physician at Unity Health Toronto, and he teaches as well. So Dr. Dosani is assistant professor at the Department of Family and Community Medicine at the University of Toronto. So yes, that's the big welcome. We are happy to have you here.
Thank you, Anya. Thank you so much. And big shout out to you and your entire team for doing this work and doing healthcare differently. This is such important work. And a reminder, this is the last episode of this season, but not the last episode, right? So this is great work and it's going to continue.
Yeah,
Awesome. Kudos to you.
thank you. I actually was thinking about the fact that like it was so overwhelming. Like I thought if I sent out invitations across the country, like maybe half the people would answer me, but like pretty much everyone answered. So we're like already booked with guests for the fall. And I
Amazing.
think it's a blessing, but it also speaks to the fact that those of us who have different identities in medicine, and we have guests who are in nursing and research and other areas who are working in healthcare, like we realize and recognize that representation matters, but also bringing our own energy, our own purpose based on our journey and our lived identities. It matters, and we want you folks. And I see all of you, waving and logging in. Thank you, because we're doing this out of love for you and the hope for a better healthcare system. It's not because it's perfect. It ain't perfect. No. But
For
but
sure.
it's that hope that we have. And so with that actually, Naheed, I know that you talked about it in the videos, but for those who missed the video, do you want to talk a little bit about how you are healthcaring differently? And also a little bit about like what is palliative care, hospice care, because we don't learn a lot about those when we're thinking about medical school or even the first couple of years of medical school.
Yeah, for sure. So, just to start off with like how I come to this work is that I'm the son of two refugees who came to Canada in the 1970s, fleeing war and persecution from a country called Uganda. And so the upbringing of being the first generation to two refugee parents really for me highlighted the ways that inequities and access to social supports, resources, and you bet healthcare can make a real big difference. And thinking about that a lot, the positionality that I bring to the healthcare work that I do is certainly I see myself as someone who supports people with their medical care, but I see myself as a social change agent, somebody who can, with my colleagues on my teams, work to facilitate the betterment of people's social determinants of health, whether that means supporting someone with housing, optimizing their income, helping them with their food security or social supports or everything in between. We have a huge role to play in healthcare and in the medical world to no doubt provide medical care, but to provide that social care and support as well. And so, I see us as social change agents through the social determinants of health. Now to your second question.
Mm-hmm.
Um, how does that relate to the clinical work that I do? I work in
Oh,
the
people are
realm of
sending love. I see hearts. I'm just letting you know. I'll
love the
jump in every
hearts.
now and then when yeah,
Love
yeah.
the love. And so, yeah, in the work that I do as a palliative care physician, palliative care is a area of healthcare that really aims to support the holistic needs of people who have serious illnesses, who are often dealing with progressive illness and often their end of life journeys as well.
Yes.
Palliative care is delivered in clinics, homes, hospices, hospitals, and in various spaces, and actually, provides medical care, but also quality of life care like pain and symptom management, emotional support, psychological supports. And so, I really care for people who are, dealing with a new diagnosis of a life-limiting disease all the way up until their end of life, and then supporting their caregivers and families through that journey, and then even the bereavement phase as well. So it
Mm.
doesn't get talked about as much, I think, but palliative care is a
Mm-hmm.
really important part of our healthcare system.
Yeah, I think that's it. It doesn't get talked about as much. And it's really interesting because I remember, I mean, it was a while ago, but when I did my palliative care rotation, I remember thinking it was like, it was peaceful and it felt like real holistic medicine because there was a moment to like breathe and actually think about the whole person instead of being in this rush to like solve the one problem that usually we had reduced the person to like the heart attack in room 3 anyways. And so that was the thing that struck me most. But at the same time, the other thing that I noticed is that when I was on other services, like other physicians still felt really uncomfortable with the idea of palliative care. So that even for cancer patients who, would have benefited from the support way before things became, quite terminal, the the doctors didn't even talk about end of life with them. Like you would see patients where clearly should have been with palliative care, let's say in the emerge, whereas nobody had talked about end of life care. So it was just, you know what I mean? There's this like
Hmm.
comfort and approach that's holistic. And then the other side of medicine, where you're supposed to quote unquote be saving lives, this total discomfort with, what happens when you can't, I guess, quote unquote, cure
To-
it, right? And this great
totally.
discomfort. So is
Yeah.
that like, was my observation, because I'm an N of one. So
No,
is that
your
very
your
accurate?
your N of one has been verified in many studies, and
Okay.
there's a growing body of knowledge that has proven the fact that we have this tendency in healthcare to reduce things to single dimensional issues, like you talked about the heart attack in room 3 or whatever it might be. And what palliative care does is really meet people where they're at and allow people to really talk about what they feel and direct the care around that. It's really just what good care could and should look like. And so what we've learned is that patients and their caregivers really appreciate palliative care once they get exposed to it and learn about what it is. What we've also learned is that healthcare practitioners, like you mentioned, often feel a discomfort with bringing up the concept of palliative care. But once they do, they learn, what we've seen is that actually care becomes a lot easier to provide. There's more satisfaction on the side of healthcare workers, the patients and the caregivers. And so more and more there's a growing understanding of the role of palliative care in different contexts. And I can say over the last few years, I've just seen so many of my colleagues say, I didn't realize that palliative care on the inpatient hospital side could be this helpful, or how a home-based palliative care visit could make such a difference, or how outpatient palliative care clinic can really help to provide that extra layer of support. And so it's become beneficial in so many ways. We have a long ways to go, but awareness and conversations like this are a big part of that.
Yeah, no, the awareness is key. And I think also, I mean, you and I have spoken in the past about even like for Black patients or other racialized patients, it's also much more complicated culturally, but also because people experience racism in these systems. And then now the system is trying to prepare you for end of life. There's going to be a distrust there. And also, sometimes there isn't the cultural competency in palliative care. So maybe we can dip into that later, or if you folks have questions about that, right, that intersection, we're happy to take those questions. But I just want to kind of, because you spoke to the palliative care piece, but just so people understand kind of, so there's also the work that you do, like what's the difference between palliative care versus hospice care? And then you also work with folks who are experiencing homelessness. So how are those similar but different as far as your clinical practice?
Yes. So as it turns out, the systems that we've designed to deliver palliative care in our communities, go figure, they don't meet people where they're at all the time. And there are many people who lack equitable access to care. A significant proportion of people who lack equitable access to palliative care are people who experience homelessness, mostly because we've designed a system where you really do need a home, a phone number, family members to support you, and some disposable income to
Mm.
receive palliative care in your home setting. And so the work that I do and have done for over the last decade is work to change that, and developed a new program with my colleagues called the PEACH program, Palliative
Okay.
Education
Yes.
and Care for the Homeless, which really aims to support people where they're at, by going on the streets, in shelters, respites, drop-ins, supporting people who are unhoused, people experiencing mental illness, comorbid poverty, people who are also dealing with substance use, for example, to support them right where they're at, in a compassionate way, in a trauma-informed way, in an anti-racist way, because we know the
Mm.
disproportionate impact that homelessness, the representation of racialized people among the homeless population, especially here in Toronto, for example.
Yes.
And so to really change the way we do things. And the program is, we're celebrating our 10-year anniversary this year, which is kind of
Ah,
cool. Cared for over 1,000 clients since we started. And actually, the program's been replicated in cities across Canada and around the world. So we're now part of a global family doing this work. So that's to give you a sense, kind of a little bit of what the Peach program is all about.
that is really cool. And I think, yeah, I mean, starting something like the Peach program, it's taking that creativity, it's recognizing where there's a gap, and then leveraging the privilege that we have as physicians, right, and healthcare workers. So all y'all, again, bring your journey, bring that energy into the healthcare field, because we need that creativity. We need to be able to improve health for those who are experiencing inequities, marginalization, structural oppression, right? Um, but you weren't always, the faculty leader that you are today, who's like, changing things up and disrupting from a social justice now, like construct within medicine. So, like, can we just like go back in time a little bit? I was trying to remember when we met, because I feel like we've just been doing this work, like doing the like being at the same
We've been
table.
vibing for a long time.
Yeah. But like early,
Yeah.
like let's go back, right? Like, so probably before I knew, when you were like pre-med or early med, like, did you experience, because you're coming in, like you said, like your parents came in as refugees from Uganda, right? I guess that was before you were born, but still, like their worldview is going to be 1 in 5 medical students has a parent who's a doctor, right? So, in Canada or in the United States. So, what was that like for you as you decided to pursue medicine?
Well, yeah, I think one of the things that I struggled with and that I hear many people talk about is the fact that there is sort of this inequity that exists in who gets access to getting into medical schools across North America, and that the processes that are in play have not always been equitable. And I know there's a lot of great work being done, especially right here in Toronto, around changing that,
Hmm.
and it's really inspiring to see. But for me, going through and not having that social currency or that social capital to know people in medicine, or have access to talk to people about what that career track was like, was really tough. And actually, it turns out, like, my family doctor growing up actually ended up being a great resource to me, and would always spend a little bit of time after an appointment just kind of chatting me up and telling me what things were like, and in the role. And then actually, because I didn't actually remember, this was before like social
Right.
media and things like YouTube and things like that. Like,
Yeah.
I just read books that were written by Canadian doctors, by Dr. Richard Heinzel, James Verbinski, Samantha Nutt, and many others, to get a sense of what it's like to be a Canadian physician dealing with social, health issues.
Yeah.
Those three physicians were like, my heroes. Did a lot of great work in like global health work, for example.
Hmm.
And so just learning about what that was like as a Canadian physician, and then taking that work abroad, was huge. And that work is really important. But when I got into medicine, I have to say that I had several mentors who opened their door to me to be able to give me a chance to do research with them. And that was really important as well. And so it's important to recognize that not everyone has the social capital to be able to come to this the same way. You shouldn't let that discourage you. And actually, Anya, like, I think that's what you're trying to do. What you're trying to do is democratize this information. Not to put words in your mouth, but that's what
No,
I
no.
see you doing, and that is
Yeah.
so important. Like, I can't express how important that is, because I know there's someone out there who's like me back then, thinking like, I don't know enough people to get into this thing. It seems like you have to know people to get in, and that really isn't how it should be. But the research shows that there's an element of that that's playing a role in who's getting in or not getting in into our medical schools, for example. So I just wanted to share that, because I'm sure there's some people out there who may feel that way. And that's kind of how I dealt with it. Nowadays, there's like social media, there's you, Anya, there's like YouTube, there's lots of ways to follow people and learn more. And in a way, I think that's a good thing.
Yeah. No, no, no. Absolutely. And, even though, so my whole thing is, okay, sure, like maybe 1 in 5 medical students has a parent who's a doctor. Okay. But then I'm like, okay, I can be auntie. That's why like, these are the conversations that happen at the dinner table for those folks. We're bringing it to Instagram. We're bringing it to you, right? So now
No doubt.
maybe, Naheed, you didn't know you're coming as an uncle, but you're an uncle at the table,
Happy to be an
right?
uncle.
But bringing to the table. And then like, so there's two things you said. You said you sought examples and people that you didn't know. You read their stories, and now, I mean, there's still people that you folks who are tuning in can read about. But again, there's social media, there's movies, there's so many ways to learn about the lives of physicians. But another key piece was the mentorship. And what's so beautiful right now is that there are so many diversity pathway programs into medicine that start from high school and many of the schools. So we sent that out in our last newsletter. So all of the different pathway programs, like just exposure to healthcare, all the different programs across the country, then the ones that are specific if you're Indigenous, if you're Black, if you're low income, if you're Francophone, there's so many different pathways, but we just want to make sure you folks know about those. And then the other things is like opportunities to like shadow and have jobs in the hospital. And that's another area where the kids of doctors, get to like have little summer jobs. So we're gonna be giving you that information. So yes, definitely, Naheed, where you said democratize, that is exactly, what we're trying to do, and amplify the great work of those who created programs like the Community of Support, like Okafor
Yeah,
and others before him. So yeah, we're kind of like amplifying what already exists. So you folks,
amazing.
again, like, I mean, you can follow Naheed on Instagram, you can follow me, but also just check out the newsletter. You go to healthcaringdifferently.com to be able to get the monthly newsletter, and we connect you to all those systems that provide mentorship and opportunities. Okay, it's 7:18, so this is where I'm going to like flag that if you folks have questions, comments, like this is the time All you'd like to wait until it's 5 minutes to the time. Please, if you have questions, so you're bringing out my Trini. If you have questions, please post them in the chat, or you can put it in the. Now I know how to use the question box, folks. Like Naheed, remember we were talking about Instagram Live? That little question box in the corner, like, wasn't there during the pandemic when I did lives, and I
I
just
see
figured out
that.
how to use it. Just figured out how to use
Wow.
it, like 2 episodes ago. But anyways, so you guys bring your questions. I'm gonna ask Naheed. I'm gonna ask you another question while we're
All right.
waiting. But comments, questions, love, like put it in the
Yeah,
chat. This is the
bring
this
it.
is the time. We're at the table. But one of the things that I know you started was the Radical Love Equity Oriented program. Can you talk about that? And then there's the question. But tell us about Radical Love, and
Yeah,
then
for sure.
I'll start looking through the questions. They're coming.
Yeah, so with the Peach program, we really work to develop a new way to deliver healthcare for people who need palliative care and who experience homelessness. And like I said, we've worked along for many years, now 10 years to do that. But as it turns out that n sometimes people are not able to die within their homes for various reasons. They don't have a home, they don't have social supports, or things get too complex. And so it probably wouldn't surprise folks to hear that actually, if you're experiencing poverty or homelessness, it's extremely difficult to get access to hospice care. So for the last few days, weeks, or months of your life, when you need more 24/7 care, medical care. And so what I did with colleagues in my role as medical director at Kensington Hospice, Toronto's largest hospice, is we developed a new program. We called it Radical Love, an equity-oriented hospice palliative care program that aims to not only admit people to the hospice based on their medical diagnoses, but also based on their social diagnoses. So
Oh,
taking into account experiences of trauma, racism, poverty, homelessness, mental illness, etc., and starting to like layer that complexity onto the medical piece that we often don't do in healthcare. Um,
yes.
and so, in a short amount of time, actually, we've gone from a hospice that cares for structurally vulnerable people, perhaps less than 5% of the time, to a hospice that is caring for structurally vulnerable people 40 to 55% of the time.
Oh,
And just thinking about like a 19-bed hospice and the changing culture and what that can do, it's created a low threshold, low barrier approach to hospice care for people who otherwise wouldn't get it. And so we called it Radical Love because in its truest sense, like someone asked us one day, like, what is this program really about? And we realized it was actually just radical love, the kind of love that a health system should provide to people who've experienced trauma that it doesn't often or always offer. And that's where the name comes from. So yeah, that's what radical love really is about.
I love that. And in medicine, we're always hesitant to use words like love. I mean, even our competencies, I know the CanMed's competencies are being redone, but I did a search at a certain point for the previous version, and there's no like role of healer or healing or you know what I mean? Anything like that. It's like medical expert and so I love that you put love central to that because it's such a beautiful thing. And from that, everything else, you know what I mean? I,
No,
I I
thank
feel like it just,
you. Humanity, compassion, like we just find that
yes.
sometimes the documents that describe our profession or guide where we're going are somewhat lacking in some of those words, right? Love,
Yeah.
humanity, compassion, etc., right? But yeah, no,
Thank
thank
you.
thank you for all the kind comments and all the hearts and everything. Thank you so
Yeah.
much. Nice to see like the support from Australia. Thank you so much.
Oh, we got Australia in the house.
Here's
Your peeps showed up. We've got, I think this is how you pronounce it, Deontay's Handcrafts. I don't know if you know that person, but what's up, Deontay's Handcrafts? So I see your question. How did you deal with discrimination during your journey?
Yeah, I mean, I think it's important to talk about how people who come from diverse backgrounds experience discrimination. For example, in medical training, I'm not sure if you experienced this, Anya, but in my medical training, I was placed in several communities, often like rural North communities, where like I didn't come from spaces like that, and it was very new to me. And there were often overt and covert forms of racism that I faced while working in the emergency department or hospitals. And what I found is that those experiences were very hurtful. But what I found was really helpful was that I had faculty or supervising staff who would notice what was happening and not just let it just happen and then just move on. They would actually take time to pull me aside and chat with me about it. And these were often white faculty, actually, which I thought was really cool, like really
Yeah.
amazing to see how trauma informed they were. They had this racialized medical student who'd never been in a community like this, experiencing racism at the hands of, patients who like, nobody wants this to happen, but happening under their watch. And they would take me aside and have a chat with me and work, and support me and give me the time I needed. And I thought that was really helpful. So having, supportive staff is one way. The second is having a community of support, which is kind of like really key to the work, as you know, Anya, and the community support
Yep.
that you support. Having many other people who do this work and who are into activism and into the issues that I'm into. I have a WhatsApp group for every social justice issue that I'm into.
Yes.
We have a social media group. It's like digital, it's phone calls, it's everything, right? I'm part of a writing group, and like so in many ways, I'm constantly invigorated by people who are allies in this work. And then I think you use the experiences that you have to fuel you. I
Yes.
think everybody deals with those kinds of experiences differently, right? But for me, it channeled me to be like, okay, no, I need to like dig into anti-racism in healthcare because I experienced racism as a trainee going through healthcare. So I got to go do something about that. And that's the cool thing about medicine and healthcare, is that just to varying degrees, we have the agency to be able to influence and inspire change. And I see you doing that, Anya, through this and many other things that you do. And I'd like to think that in my world, I'm able to do that too. Yeah, so it's a great question, taking me back. And I reflect on the many other trainees who deal with discrimination as they're going through their medical education training too. And power to them. And I hope we can create a better health system for the future.
Absolutely. Yeah. And so I'm hearing you say, you looked for allies, and sometimes you try an ally, somebody you think is an ally, they might not be an ally. Keep looking for the ally, right? It's
No
important.
doubt.
So you identify allies and you did that, happen to be in that space. Sometimes they might be in another space, or your last rotation supervisor, somebody who's an ally to debrief with. Then you looked for like-minded folks, right? And that you build that kind of community over time, but looking for peers and people who can validate that kind of experience and provide support, laughter, tears, whatever you need to do in community. And then the third thing you said is let it fuel you. And I love that you said that, because we talked about that in some previous episodes, like especially in the context of imposter syndrome. Like, some things you have to put in your back pocket. Sometimes you can speak up in the moment, sure, or now there are pathways to file a complaint, right? A lot of those didn't exist during our time, but the other piece is like some things you can't really change the structure at the time, but you put it in your back pocket and you allow that to be part of your purpose, and let that purpose be louder than whatever imposter voice is coming at you. But definitely let that fuel you. It's always good to have a therapist to help you work through it too, because
Yeah,
sometimes that fuel can just send you like too far and working around the clock, which we talked about with Dr. Marsha Anderson. Like, it's too much
for sure.
fuel sometimes, right? But it really is important for it to be part of your coping mechanism. It can help that you're part of the change of the system that caused harm.
Totally.
We're getting comments. So yes, now I see the Australia one, because I was like up further scrolling for the question. But yeah, good day. So Sandia, I don't know
Sandhya.
if that's Sandia. Nice. Okay, thanks, Sandia. Good day from Australia. Naheed, you are an absolute legend. That's why I felt like I should read it, because I have to like emphasize
Thank you.
legend.
Thank you. Very sweet.
We need your passion, love for the palliative homelessness work here in Sydney. I love how your approach is different. Are you working out in doing any work in collaboration with folks in Australia? Oh,
You know
hearts are
what's
coming.
what's really wild is that we're building connections with many jurisdictions around the world, the United States, the UK, and Australia, New Zealand as well. And so we're really getting the sense that this mobile palliative care work for structurally vulnerable people is actually like a global health intervention that probably should be present
Mm.
in many countries around the world. And so what started at the back of my Honda Civic, has like kind of turned into this thing, and it's really amazing to see, and it's really heartwarming to see so many health workers and social care workers who are like spreading this thing and spreading that love, right? That radical love that we need to see.
Yes, yes, that's it. That radical love. Solma Makwa, I don't know if I'm pronouncing that correctly, says hello to us both.
Hey,
And then Sandia again, love, humanity, compassion, the basics. You would think it was the basics. We need to make it the basics. And you folks who are tuning in now, because you're the future of healthcare, you need to help make it the basics. I'm just scrolling if we have other questions. Very infectious, your work. Oh, I like that. I like the
me too.
idea. I like infectious ideas actually. I mean, it might be because I'm public health. There's a bias, but I've always liked
That's a bias,
that
yeah.
concept, right, of infectious ideas.
Yes, yes, love it.
Um, okay, so we're at 7:29. Do folks have any more questions or comments? Welcome, welcome. But we're at 7:30, so we're going to be wrapping up soon. But any other questions or comments? Or Naheed, is there anything else that you want to say that we haven't spoken to?
No, not in terms of questions, but just to say, Anya, like, thank you so much for this work, and to those who are watching, I hope everyone realizes how incredibly inspiring Anya is, both externally to the medical community, but internally to the medical community. You have a lot of respect, and you have stood the test of time. You've been courageous, you've been dedicated, you've been persevering on multiple tracks of advocacy for better outcomes for our patients, but also for the next generation of medical and healthcare professionals across this country and clearly around the world. And so, Anya, I want to thank you, and we should all thank you because you are doing trailblazing work. Much respect, okay?
Oh, Oh, that's so sweet. Thank you. Well, I
No
mean,
problem.
right back at you. I mean, that's why you're a guest on this show. So I will, I accept, I recognize, I take the flowers. So thank you. But I also want to thank you for making the time. I'm sure you had a very busy day, but making the time and coming on to inspire, the next generation of healthcare leaders. Because if you're a change agent, you're leading in some way, even if it's just yourself. That's what I tell my kids. Like
For
sometimes you
sure.
need to not be following and lead yourself, and that is huge in and of itself. So with that, I want to thank you for joining. Thank you for the incredible, inspiring work that you're doing.
Thank you.
I want to say thank you to our audience members. Thank you again. This is the last episode for this season, so thank you to our team. We'll be having lots of thank you posts because it took really, again, this kind of work takes a village, right? And there's so many people behind the scenes who supported. And so please continue to follow us. Please continue to share. Like I said, we'll still be posting videos during the summer. The newsletter will focus on summer jobs and research opportunities. And I'll be posting, content on how I healthcare differently. And please do join us for season 2. And Dr. Dosani, if you know of any, opportunities for students to shadow or have research work, please do let us know. And if you're doing anything really cool, we're always happy to like cross post and share. So,
Sounds great.
um, yeah,
Amazing.
yeah, I'm
Thank
seeing
you.
that.
Thank you so much for having me. Appreciate it.
Thank you. And I'm seeing, oh my gosh, Sandy is just sending all this like love. And y'all, I mean, again, people can DM you, but Sandia says, this was such a positive session. Great start to my day. Oh, right, because y'all are ahead of time.
True.
Um, I'm infused with love and positivity now. Oh my goodness, that's so
Much love.
beautiful.
That's
Much
very sweet.
love. Yes. All right. And the hearts are there. Okay.
All
Thank
right,
you.
cool. All right.
Have a good night or good
Thank you.
morning, everyone.
Yeah. Good night or good morning.
Bye.
Take care. Bye.
Bye.